This is Dr. J.Seo, a plastic surgery specialist in Area 88. Patients frequently ask questions about facelift and hemobag. In YouTube videos and consultations from other hospitals, patients are told there is no need for hemobag insertion. That if hemostasis is properly dealt with, it isn't necessary. Some even go on to say inserting a hemobag means the SMS has not been dissected. There are many types of facelift surgeries. For related videos, please check the links in the description box below. Today I will discuss under what circumstances hemobag are inserted and when they are unnecessary. This is the most common type of facelift surgery performed by plastic surgeons and non-specialists. Only the skin is dissected, and the method of ligation is applied to the SMS. A surgery called MAX was once popular, but it is no longer performed. There are many cases where patients are told that they will undergo facelift, then they are inserted with elasticum or cog threads. This method of simply tying up the SMS isn't effective in terms of maintenance period or results, thus it isn't often used. This is because there are many procedures that can achieve such level of results without the incisions, thus excluding this method that does not lift the SMS. Surgery types for facelift include deep plane, which lift the skin and SMS at the same time, and dual plane, which lifts the skin and SMS separately. The red line represents the area where skin is dissected, the solid line in blue represents the line where incision on the SMS is made, and the dotted line in blue represents the range where retaining ligaments are snipped and the SMS dissected. The surgery range for deep plane as shown on the left is usually around 5 to 6 centimeters for Asians and much less for Westerners with smaller faces, around 4 centimeters. On the right, the dual plane dissection range for the skin and SMS is more than twice as wide compared to the deep plane. The deep plane method lifts the skin and SMS in one direction at one go till the dotted line. And the dual plane separately dissects the skin up to the red. And the SMS is pulled to a different vector with all retaining ligaments disconnected up to the dotted line. The most representative deep plane methods from textbooks are Dr. Hamra's composite facelift, Dr. Barton's high SMS technique, and Dr. Ramirez's subperior steel facelift. All these surgeries are deep plane. The skin is dissected around 4 centimeters from the incision line, then the skin and SMS, or the periosteum also, are elevated all at the same time. Dr. Baker's lateral SMSectomy is one of the commonly performed surgeries, a method that simply cuts then sutures the SMS, often altered into a deep plane surgery. A surgery called ESP was briefly introduced in 1997. But currently it's rarely used due to various problems. The methods being introduced now are from the American Aesthetic Surgery of the Face and Elegant 2012. And these are all very historical and well-known surgical methods of facelift published in the United States. Being in an American textbook, ESP is introduced and sometimes classified separately, but it isn't meaningful. When properly performing facelift surgery, neither lateral SMSectomy nor ESP is commonly used. Taking these deep plane surgeries as base, there is extended deep plane facelift with widened dissection of SMS by Italian Dr. Bode. And the same with Australian Dr. Mendelssohn's complete composite facelift. Most of these surgical methods do not include the mid-cheek, so, lower blepharoplasty, liposuction, and fat grafts are done simultaneously during facelift. A prime example of dual plane surgery is Dr. Stuzan's extended SMS and Dr. Martin's high SMS. The difference between the two is the shape and location of the SMS incision and dissection of skin. For me, I mostly operate with Dr. Martin's skin dissection and Dr. Stuzan's SMS design. The advantage of the deep plane, which pulls the skin and SMS simultaneously, is that the operation time is as short as 2 to 3 hours. And there is little swelling, and most of the time, there is no need for a hemobag. Also, recovery period of about 5 days is enough. The disadvantage is that the skin and SMS vectors can only be pulled in one direction. The skin has to be pulled by that much, thus there's a lot of skin over-tightening and temporal hairline displacement. Instead of removing the wrinkles under the skin, there is wrinkle shift. And it results in an unnatural face. In Asians especially, this causes the malar to become wider. in order to improve the anterior malar and mid-cheek including the nasolabial fold. An incision is made under the eye and lower blepharoplasty and Facelift are performed together. And by suction of the nasolabial fat and fat graft of the nasolabial fold, the mid-cheek is improved. Still, for the deep plane, there is little malar descent, so if lower face correction is the priority, recovery is quick, so it can give quite decent satisfaction. The dual plane elevates the skin by 12 to 13 cm, and the SMS is elevated by disconnecting the retaining ligaments up till the mid-cheeks. The advantage to this surgery is the ability to choose the SMS vector freely, and because the retaining ligaments are disconnected up till the mid-cheeks, large amounts of SMS can be elevated. For the skin, appropriate amount can be cut and pulled towards the appropriate direction. Therefore, there isn't much tension in the skin as in a deep plane. Little deformation in the hairline and wrinkles under the skin can be resolved rather than being relocated. Because there's little secondary deformation from the facelift, the face can be natural, skin tension, hairline displacement, and objectionable wrinkle shifts can be avoided. The disadvantages are that the operation area is more than double that of the deep plane, so operation time is long, about 5 hours, the operation is difficult, and surgeon's technique is much required. Also the skin is dissected more than 12 cm, therefore a hemobag will be needed and recovery will be long. Other than that, potential drawbacks mainly happen with doctors lacking in technique. Complications may arise during the adhesion process when skin with inherent problems is dissected. I will explain the solution to this in the next video. Otherwise, the advantages of dual plane surgery are that it can improve the mid-cheek groove, solve problems caused by excessive fillers and fat grafting, and give natural results as skin isn't pulled by force but rather the remaining parts simply resolved. Furthermore, surgery can be done to Asians with large molars without making them wider. This surgery is into lower blepharoplasty in the lower eyelids but a dual plane facelift, but you can see the mid-cheek groove has improved. When a dual plane surgery is done like so here, lower blepharoplasty isn't done simultaneously, but rather considered around 3 months later with Facelift. This is a dual plane surgery done after a deep plane facelift and liposuction attempting to address complications from excessive fillers and fat grafting on the face failed to improve problems. With the deep plane this area cannot be resolved. Therefore liposuction must be done from the outside, in which has its limitations. This causes many problems. This photo presents the typical drawbacks of the deep plane, where the skin and SMS are elevated in one direction at one go. Because the skin is pulled as much as the rest, it results in a flat, unnatural face. Reoperation using the dual plane was done to fix this. Most videos and explanations about facial lifts daily divide into mini or traditional facelift, classify facelift by operation time or mere recovery period. Absurd claims even go on to say inserting a hemobag is evidence the SMS has not been lifted. This just means they've never done this type of surgery or is completely ignorant of what facelift is. When dual plane surgery is done, hemostasis is done very thoroughly. Moreover, hemostatic agents are applied to the surgical site before coming out. Even then, hemobag is inserted. Thus not inserting a hemobag just because hemostasis is done well means it isn't dual plane surgery. Even with the deep plane, blood can accumulate, so a tube is inserted and removed the next day. Some even claim they don't insert the hemobag but rather use elastic drain, as if it's some kind of new innovation. These have been used for decades, they shouldn't be saying this. Nowadays, lifting and rejuvenation are classified separately, and unheard of theories are told saying thread is lifting and surgery is rejuvenation. The decision on surgery should be made first on what you want to improve, then on the follow-up treatments, recovery period, personal schedule, and cost. Distinction can be made on which individuals can benefit from the deep plane and which from the dual plane, then surgery done accordingly. Key points should not be ignored. Next time, we will compare each frequently performed facelift operations. Thank you.